Colon cancer is not rare. It is not some distant disease that only happens to other people. Worldwide, colorectal cancer caused about 1.9 million new cases in 2022, and more than 900,000 people died from it. Welcome to the Wellness Blueprint, where we break down important health topics in a simple, clear, and practical way, so you can understand your body better and make smarter decisions for your health. Today, we are talking about colon cancer, the warning signs people often ignore, the facts and numbers everyone should know, and why early screening can save lives. Before we begin, subscribe to the Wellness Blueprint for more health education videos like this. If you care about learning how to protect yourself and your family, this channel is for you. Here is the part that makes this disease so dangerous. Colon cancer does not always begin with a dramatic warning. Sometimes it begins with something small, a change in the bathroom, a little blood, a stomach pain that comes and goes, a tired feeling that does not make sense. And because these signs feel private, embarrassing, or easy to explain away, many people wait. They wait 1 week, then 1 month, then longer. And by the time they finally get checked, the problem may have had time to grow. This video is not here to scare you. It is here to make one thing clear. When colon cancer is found early, the story can be very different. Colon cancer starts in the large intestine, and rectal cancer starts in the rectum. Together, they are called colorectal cancer. In many cases, the disease can begin as small abnormal growths called polyps. Not every polyp turns into cancer, but some can change over time. That is why screening matters. Screening can find cancer early, and in some cases, it can find precancerous polyps before they become cancer. That is a huge difference. In the United States, about 158,850 new colorectal cancer cases are expected in 2026. About 55,230 people are expected to die from it in the same year. Those numbers are not small. That is why this conversation matters. One of the most important warning signs is a lasting change in bowel habits. Maybe a person who used to be regular suddenly has diarrhea again and again. Maybe constipation becomes unusual. Maybe the stool becomes narrower than normal. Maybe going to the bathroom feels different, like the body is not emptying completely. One strange day does not mean cancer, but if the change lasts, repeats, or keeps getting worse, it should not be ignored. Another warning sign is blood in the stool or bleeding from the rectum. This is one of the signs people explain away the most. They may say, it is probably hemorrhoids. They may feel embarrassed. They may decide not to talk about it. And yes, bleeding can happen for reasons that are not cancer, but guessing is not a diagnosis. If there is blood, especially if it happens more than once, it needs medical attention. Then there is abdominal pain, cramping, bloating, or discomfort that keeps coming back. Everyone gets stomach issues sometimes. Food, stress, infection, and digestion can all cause problems. But when pain keeps returning, or it comes with bowel changes, bleeding, weight loss, or fatigue, the body may be trying to get attention. Unexplained weight loss is another warning sign. Losing weight without trying might sound good to some people, but the body does not usually drop weight for no reason. If someone is eating normally, living normally, and still losing weight, something may be wrong. Fatigue can also be part of the picture. Not normal tiredness after work. Not the kind of tiredness that improves with rest. This can feel like deep weakness, low energy, dizziness, or shortness of breath. One reason is that colon cancer can sometimes cause slow bleeding inside the digestive tract. Over time, that can lead to anemia, and anemia can make a person feel exhausted. Now, here's a number that should make people pay attention. In the United States, the average lifetime risk of developing colorectal cancer is about 3.9%. That means roughly 4 out of every 100 people may be diagnosed with it at some point in their life. Age matters, but age is not the whole story. colorectal cancer is still more common as people get older, and it is most often diagnosed around the mid-60s. But younger adults are not immune. In fact, rates in people under 50 have been rising. From 2013 to 2022, colorectal cancer diagnosis rates increased by about 2.9% per year in people younger than 50. That is one reason doctors no longer want people to think of this as only an old person's disease. Screening is one of the biggest weapons against colon cancer. For many average-risk adults, regular screening should begin at age 45. That does not mean everyone waits until 45. Some people may need to start earlier, especially if they have a family history of colorectal cancer, a personal history of polyps, inflammatory bowel disease such as Crohn's disease or ulcerative colitis, or inherited conditions like Lynch syndrome or familial adenomatous polyposis. If someone is at higher risk, they should not guess. They should speak with a doctor about when to start and which test is right. There are different screening options. Some stool tests can be done at home. Other tests, like colonoscopy, are done in a medical setting. Colonoscopy is especially important because doctors can find and remove some polyps during the procedure before they have the chance to become cancerous. That is the part people need to understand. Screening is not only about finding cancer. Sometimes it is about preventing cancer. And the survival numbers show why timing matters. For colon cancer that is found while it is still localized, meaning it has not spread outside the colon, the 5-year relative survival rate is about 91%. But when colon cancer has spread to distant parts of the body, that number drops to about 13%. That gap is massive. It is the difference between finding a problem early and finding it after it has already moved beyond the original site.
The same pattern is seen with rectal cancer. When it is localized, the 5-year relative survival rate is about 90%. When it has spread to distant parts of the body, it is about 18%. These numbers do not predict what will happen to one individual person. Every case is different. Treatments improve. People respond differently. But the message is still clear. Early detection matters. So what should people watch for? A change in bowel habits that does not go away, blood in the stool, rectal bleeding, ongoing abdominal pain or cramping, unexplained weight loss, unusual fatigue, weakness, a feeling that the bowel does not empty completely. None of these symptoms automatically means cancer, but persistent symptoms deserve attention. The most dangerous thing is not asking. The most dangerous thing is pretending it is nothing because the topic feels uncomfortable. Doctors talk about these symptoms every day. There is no shame in asking about blood in the stool. There is no shame in talking about bowel changes. There is no shame in getting screened. The real shame would be ignoring a warning sign that your body kept trying to show you. Colon cancer is serious, but it is also one of the cancers where screening can make a real difference. It can detect disease earlier when treatment is more likely to work. It can also find certain polyps before they become cancerous.
So if you are 45 or older, ask about screening. If you have symptoms, do not wait for your age to qualify you. And if you have family history or another risk factor, talk to a healthcare professional about whether you need to start earlier. This video is not a diagnosis. It is a reminder.